Hi, my name is RullaTamimi. I'm really excited to be a part of this session today. And I'll be talking, my title of my talk is Where Are We Now and What Directions Should We Be Taking? And I've taken some artistic license here in really thinking about what directions I'm hoping to take my own research. So these are sort of new areas for me. But I'm excited to kind of share my motivation and why I think this is an important area. I have nothing to disclose. My CME multiple choice question is, among women with estrogen receptor positive disease, adherence to adjuvant endocrine therapy is suboptimal. Which of the following statements are true? A, adherence rates are lower in Black women compared with white women. B, adherence rates are lower in older women compared with younger women. C, adherence rates are impacted by side effects and symptoms. D, all of the above. E, only A and C. So in terms of the objectives of my presentation, I'm going to start, I'm an epidemiologist. I feel like I always have to start with the descriptive epidemiology. And then I'm going to talk a little bit about predictors of adherence to adjuvant endocrine therapy. I'll also discuss the impact of COVID-19 on psychosocial outcomes and kind of bring those two together in terms of how I think that these may influence adjuvant endocrine therapy adherence, as well as ultimately the impact on breast cancer survival, and then end with future directions and opportunities to improve outcomes. I'm sure many of you are familiar with this slide, which shows the age incidence curves for breast cancer by race and ethnicity. And I think what's important here is really that breast cancer occurs relative to other cancers earlier in life. And so this is in a woman's life, can occur at a time when she is still premenopausal, when there are childcare responsibilities, when she's still working. And so all of these things also influence her psychosocial well-being, and it can impact her response to treatment and the way that she approaches treatment and side effects. I think as many people know, breast cancer mortality or the survival rates have really been improving over time, which this graph illustrates nicely. Since the 70s through the 2000s, we've been seeing an improvement in the 5-year relative survival rates. There continues to be a disparity by race. These show the 5-year survival rates comparing white women to Black women. And you can see even in the latest year that's here, that again, there continues to be a disparity between Black and white women with respect to survival. Oops. And I think we are used to seeing statistics that really relate to the 5-year relative survival. And for breast cancer, those numbers are high relative to other cancer sites. But I also wanted to highlight on the right that many women survive for much longer. And even beyond 5 years, though, women are still at high risk of dying of their breast cancers. And this is true even for estrogen receptor positive breast cancers, which are the blue line here. And I added this pink line to kind of show what we normally see, which are these 5-year relative survival rates, but really to try and have a better view of the long-term survival rates, which do differ by hormone receptor status. But again, wanting to highlight here that especially for women with ER-positive disease, they continue to be at risk for breast cancer specific mortality. Some of the work that we had done using data in the NCCN was really to look and see if there were disparities in breast cancer survival that were different by Black and white women once we looked within tumor subtypes. And if we start and look on the right-hand panel, we see that we did see that among women with ER-negative disease, and we know that Black women are more likely to have ER-negative disease relative to white women, there was a higher risk of mortality for Black women relative to white women. And when we took into account different factors, we actually saw that we could explain away a lot of the differences that we saw. And ultimately, if you took into account many factors, there ended up being no difference in mortality. When we looked at ER-positive disease, we actually saw an even greater disparity in that Black women had about 2.25 higher risk of mortality from breast cancer relative to white women if they had ER-positive tumors. And again, we did the same exercise trying to adjust for different factors that may explain those differences. And ultimately, we could not explain all of the differences, even adjusting for treatment. And I think our interpretation of this is, even though we're adjusting for treatment, there's only, in this particular analysis, we could only adjust so well for treatment. And oftentimes it may be yes or no. And so what we're really missing may have been adherence to endocrine therapy, which could be explaining why we continue to see this disparity, especially among estrogen receptor positive tumors. So when we look at adherence in different databases, we can see that adherence in general is suboptimal. Up to 50% of women do not either initiate or complete 5 years of adjuvant therapy. In some studies, not all studies, but in many studies, both Black women and younger women tend to be less adherent to adjuvant endocrine therapy. This is just data from one study where they defined adherence about the proportion of days completed. If it was over 80%, they were considered adherent. And so you see here that Black women are about 28% less likely to be adherent using that definition compared to white women. We also see that women who are under the age of 50 are about a 35% less likely to be adherent relative to women who are above the age of 65. So there are a number of reasons why women may discontinue to use adjuvant endocrine therapy. One of the main reasons, side effects or symptoms. It's also been suggested that medication costs or the financial burden, as well as physician communication being suboptimal. And just to remind ourselves that there really is a survival gain by adherence to endocrine therapy. So the full circles are the mortality risk for women who are adherent to adjuvant endocrine therapy. And for women who are not adherent, you can see that they have a higher risk of mortality. So this was a paper looking at both adherence to adjuvant endocrine therapy, as well as the symptoms, comparing a population that included Black and white women. And in this particular study, Black women were more likely to be non-adherent than white women. They also found that Black women experienced significantly more symptoms. And if you look at the bar graph on the right, you can see here, if we look at total symptoms, the black bars for Black women and the gray bars for white women, total symptoms were significantly higher for Black women. We saw significant differences specifically for vasomotor, neurological, and gastrointestinal symptoms. There were other predictors of adherence. So women who took aromatase inhibitors were also more likely to be adherent than those on tamoxifen. And there were also some other predictors that were noted in this study. In another study that we had done in a young women's cohort, so women who were diagnosed with breast cancer under the age of 40, we did look at non-adherence predictors among these young women. And we did find that there were psychosocial factors that did predict were more likely to be associated with certain adherence. And I'll just point out a few. Women that had a high confidence in their decision to go on endocrine therapy were also more likely to be adherent. We also found that women who had high social support were significantly more likely to be adherent. And again, those that had symptoms, we found were less likely to be adherent, not statistically significant, but again, suggesting that this is one of the reasons why women may be less adherent to endocrine therapy. And when we think about social support, I think we oftentimes think about maybe friends or what our social network is. That also includes different sources of information. There can be emotional support that comes with that. So I just wanted to kind of put together the many sources that we can have of support that can help women with adherence. And we've seen not only for adjuvant endocrine therapy, but for other medications that social support is associated with improved adherence. And again, a range of places where we can receive support and different examples of how that support can actually be given to support women in adhering to their therapy. This was a really interesting study that looked at, they were able to assess among breast cancer patients some psychosocial factors. The study had started prior to COVID, so they had a pre-COVID assessment, and then they were able to follow women and ask them these same questions after starting COVID. And one of the interesting things, they were able to look at breast cancer patients who were both actively continuing their treatment, and then women who had completed their active treatment for more than 24 months. And one of the main findings that they found was that there was a significant drop in social functioning for those women who were undergoing active treatment between pre and post COVID. They did not see the same decline in women who had completed their treatment over 24 months prior. And so I think this is a really important thing to think about, is that there is a lot of loneliness of cancer patients during COVID. This was a qualitative study that did interviews among patients and their family members. I think there is fear among patients about going to the hospital and being infected with COVID, being alone in the hospital. Family members are also afraid of interacting with cancer patients, worried that they will infect them. Obviously, this is also having an impact on family members that the patient may live with. And these are just some quotes that they have, but even commenting that it's not just with friends, but even their contact with the physician is limited. So there's clearly some loneliness, as well as less patient and physician interactions. We started a study here. These are very preliminary pilot data. I think one of the main limitations of all of the studies that have been published to date in this area are that they're primarily limited to white women and really don't service a diverse patient population. And we were really interested in understanding the psychosocial impact of COVID-19 on breast cancer patients, and wanted to be able to compare those undergoing active treatment to healthy women, to survivors. Again, you'll see here that the numbers are very small. We actually saw no difference with respect to loneliness, a loneliness scale across these three groups. But we were able to, this was still a very small study, but we did see, some differences, and definitely a huge range in terms of this loneliness scale by race and ethnicity. This is another scale that we used, which assesses depression. Again, we saw no significant differences by active treatment group versus survivors. But again, we do see, at least on a descriptive level, differences with respect to race and ethnicity, and again, a wide range of scores with respect to this depression scale. And finally, we also looked at an anxiety scale. Some differences here, nothing statistically significant, but again, some suggestion that there may be some groups that may have more anxiety than other groups. So I think in conclusion, it is clear that there's an unmet clinical need to improve adherence to adjuvant endocrine therapy. Health-related quality of life, psychosocial factors are all important concerns for breast cancer patients in and of themselves. But there could be differences with respect to race and ethnicity and psychosocial factors and social support networks that could have an impact in treatment adherence. And I think especially in this time of COVID, where social support has really been reduced and could be especially reduced in women undergoing active treatment. I think this is an important area for us to be aware of and be thinking through, because understanding what those drivers are really may be important in our ability to develop interventions and strategies to improve health equity for all. And in terms of thinking about the future, I am a researcher, and I really think there needs to be more research, especially on symptoms management. Again, most of the studies that have been published have really been small, but also primarily white women. And thinking about communication patterns, how patients and providers discuss side effects, how to manage symptoms, thinking about sources of information and what is most impactful in terms of influencing either social networks or adherence independent of social networks, and how to really develop research studies. I think that think about this post-treatment phase, it can be a very long period. And so I think from a research perspective, it can be challenging, but I think also really important to look long-term and not just during active treatment or early in the survivorship phase. I think one area that can be really better tested or utilized may be telemedicine to really address some of these patient provider needs in survivorship. And I think one of the biggest challenges, I think, as we all know, is that at the beginning of the pandemic, we saw these signs about everyone staying home. Things have obviously evolved. And I think the pandemic is ever evolving, which makes it very difficult to do research. It also makes it difficult to have results from research studies that are generalizable to all populations. And you can even see that the way that the pandemic impacts social interactions and societies is different even by geographic location. So again, I think from a research perspective and from interpreting data and thinking about how can we generalize to other populations, I think this has been very much challenged. So coming back to our CME multiple choice question, among women with ER-positive disease, adherence to adjuvant endocrine therapy is suboptimal. Which of the following statements are true? The answer here is E. Although race, age, and side effects are all associated with adherence to adjuvant endocrine therapy, B was false because adherence rates are actually lower in younger women compared with older women, and B had the opposite. And with that, I thank you for your time, and I'd be happy to take any questions. Thank you.